All right, we're going to start. Good afternoon, everyone. Welcome to the 2022 Employee Benefits Open Enrollment Session. My name is Wanda Caldwell, and I am the Benefits Manager. Assisting me today is Maria Martin, Benefits Consultant, and Madison Little, who will be serving as our Zoom producer and moderator. Also, we have representatives from our insurance carriers. Some will be presenting and all will be available for questions that you may have. I'd like to take a minute to introduce them to you. From Blue Cross and Blue Shield of North Carolina, we have Jasmine Walden. From CVS, Sarah Vaca. From Cigna Dental, Beth Barnes. From IMED, Brian Boos. And from Marathon Health, Caitlin Cross. We have a lot of important information to share with you today, but before we get started, I must inform you that this presentation is being recorded and that it will be saved and available on MacWeb within 24 to 48 hours in case you missed any part of it. We want this meeting to be about you, so please feel free to ask questions after each presenter. If you prefer, you can also put your questions in the chat box. So let's begin. The topics that we'll be going over today are the following: changes in the 2022 plan year, medical options, dental and vision options, pre-tax options, Marathon Health, and voluntary benefits. We want you to know that your questions are important to us. Remember, these sessions are public, and we have a responsibility to protect your personal health information. So I just ask that you can pose your questions in a generic or general form. And please, please refrain from giving out any personal or private information. If we are unable to answer your questions during this presentation due to time or content, please reach out to the respective insurance carrier or the Employee Services Center at 704-432-6947 for assistance. So what's changing in 2022? Both of our medical plans, the PPO, which is referred to as what is the preferred provider organization, and the high deductible health plan with a health savings account, both are increasing their co-insurance from 25% to 30%. Remember, the co-insurance is the sharing of costs by the insurance and the member. Therefore, once you hit your deductible, you are responsible for the 30% of that cost until you hit your out-of-pocket max. TeleDoc will be the new telehealth service provided by Blue Cross Blue Shield. The pharmacy co-insurance is also increasing from 25% to 30%. The county's contribution to the health savings account for 2022 will be $500 for individual coverage and $1,000 for family coverage. Effective January 1 of 2022, IMED will be the new vision carrier for the county. We currently have United Healthcare, but January 1 of next year, it will be IMED. We are slightly increasing the rates for medical, dental, and vision. Under the voluntary benefits, the critical care plan is changing its name to critical illness. So let's talk about our medical plans. Mecklenburg County has two medical plan options. There's the traditional preferred provider organization, the PPO, and then there's the high deductible health plan with a health savings account. There's not a one plan better than the other. And I'll go into more detail about both in the next few slides. So what does the high deductible health plan with the health savings account offer? Well, it has a higher deductible, but with lower premiums. Preventive visits are covered at 100%. You have the 30% co-insurance, and you have the health savings account, which is a tax advantage savings account plan. The county contributes to the health savings account. For 2022 plan year, Mecklenburg County will contribute $500 for the individual coverage and $1,000 for family coverage. You can also make contributions to this account via payroll deduction up to the IRS annual limit. The annual limit for 2022 is $3,650 for individual, $7,300 for family coverage. And if you are over the age of 55, you can contribute an additional $1,000. Remember, the HSA or the health savings account can be used to pay for your out-of-pocket medical expenses, prescriptions, co-pays, and deductible. The nice thing about the health savings account is that you can roll over any unused funds to the upcoming or the following year. Now let's talk about the PPO plan, which stands for the Preferred Provider Organization. If you were hired before January 1 of 2017, you can choose to elect either the PPO or the high deductible health plan with a health savings account. With the PPO plan, you have a lower deductible and a higher premium. You also have the option to participate in the healthcare flexible spending account, which is also a tax advantage account. Your preventive visits are covered at 100%. You have a copay of $25 for office visits to your primary physician, and a co-insurance of 30%. All right. As I mentioned before, the flexible spending account are a tax advantage benefit. The county, we have 3 of them. We have a healthcare FSA, a dependent care FSA, and a commuter reimbursement FSA. You can only elect the healthcare FSA with a PPO plan, or if you opt out of the county's medical program altogether. A few things that you should know about the county's FSA plan. Well, the healthcare FSA plan, the funds are front-loaded at the beginning of the year, and your employee contributions are payroll deducted each paycheck. More importantly to remember is that any unused funds in the healthcare FSA at the end of the calendar year is forfeited. So the healthcare FSA is a use it or lose it plan. However, the IRS guidelines are subject to change, as we saw during the pandemic. So they may make a change here and there, but typically for the healthcare FSA, it's a use it or lose it plan. The dependent care FSA can be used to pay for daycare expenses for dependents under the age of 13 and adult care. The funds are not front-loaded, and you cannot roll over any unused funds at the end of the plan year. Commuter reimbursement can be used for reimbursements of bus passes, light rail passes, and van pool expenses. Rollovers are allowed from year to year for this plan. Any questions so far?
We have two questions. First question is, if you are retiring at the end of 2021, do you need to do open enrollment?
That is a very good question. And yes, I strongly recommend that, because here's what we have found. Plans change, people's plans change. And some people decide at the last minute that they're not going to retire, or they want to delay their retirement for a few more months. If you do not enroll doing open enrollment, you won't have coverage for the 2020 plan year. So I would encourage you, yes, please enroll doing open enrollment.
All right, our next question, with the spending or the flexible spending account, did you say they deduct every paycheck? And where do you find out how much you allocate for the flexible spending account?
Okay, yes, I did say that. So employees contribute to the flexible spending account. So you determine how much you want to come out of your check. Doing open enrollment, there's a section in the open enrollment process that will allow you to enter how much you want to come out of your paycheck. So that I think it will also calculate what that would look like total for the year and by pay period. So for open enrollment, that is embedded within the open enrollment process.
Right, our next question, can you use the HSA for dental and vision coverage?
Yes, you may.
Let's see. Our next question, just an observation, with the seed money going down and premiums going up and deductibles going up, it doesn't seem basically an advantage to have the high deductible health plan.
Well, here's the thing. Not everyone has an option to select the PPO or the high deductible. Remember, I said that if you were hired prior to 2017, you have that option. Those employees that were hired afterwards, the high deductible health plan with the health savings account is their only option.
Our next question, is it true that 2020 and 2021 total contributions have been extended / roll over through 2022?
I'm not sure I understand that question.
I'm sorry, that was for the FSA.
Repeat it again for me, Madison.
For FSA, is it true that 2020 and 2021 total contributions have been extended and or roll over throughout 2022?
That is a true statement. That was put in place as a, I'm going to call it a temporary amendment for the FSA plan due to the pandemic, due to COVID. So I still stand by IRS rules, IRS guidelines are subject to change. So Madison, we may have some more questions in the chat. Let's hold off, and we may be able to answer those throughout the presentation. And if not, we will try to answer it at the end of the presentation. So I'm just going to go on, move ahead and to our next presenter, which is Blue Cross Blue Shield. So at this time, I'm going to turn it over to Jasmine Walden, and she will provide additional information on the medical plan. Once she is done presenting, please feel free to ask questions pertaining to the medical plan. And between Jasmine and myself, we'll try to answer those. Ms. Jasmine, are you ready?
Yes, Ms. Wanda, I'm ready.
Okay, so I'm going to stop sharing.
Thank you. Are you able to see my screen okay?
Yes, we are.
Thank you. And good afternoon, everyone. My name is Jasmine Walden, a representative from Blue Cross Blue Shield of North Carolina, and welcome to this presentation about your health benefits offered to you by Mecklenburg County Government and Blue Cross and Blue Shield of North Carolina. Today, I will spend a few minutes highlighting some things you should know to get the most from your health plan. You can save money by visiting doctors who are in the Blue Options network. To find out if your doctor is in the Blue Options network of providers, just call us at the number on the back of your health insurance ID card. You can also go to blueconnectnc.com and use our Find a Doctor tool. Anyone can find basic information about our in-network doctors, but if you're looking for more detailed information, you'll want to log in. When you log in, you'll see this homepage. Just click on Find Care to get the information you need. As part of your preventive care services, you can see an in-network nutritionist 10 times per year for no charge. These experts can help you start good food habits, create healthy, budget-friendly menus, and know what to eat if you have health problems. And as you get the care you need, you can have your health plan information right in the palm of your hand. Blue Connect Mobile lets you securely connect your Blue Cross of North Carolina health plan whenever you want. You're able to get digital ID cards, view your claims, track your benefits, review your deductible and out-of-pocket expenses. You can also call customer service or send a message through the app. Fingerprint and Touch ID sign-in is available on certain devices, and everything on the mobile app is available in Spanish. Blue Connect Mobile is free for Blue Cross of North Carolina members. It's available on the App Store or Google Play. For support or more information, you can visit bcbsnc.com/mobile. And our Blue 365 program can help you save money while you stay healthy. Blue 365 offers discounts on healthy products and services, everything from gym memberships to nutrition programs to laser eye surgery. When you sign up, you'll get special weekly deals from well-known companies delivered right to your email inbox. From sports gear to personal care, you always find healthy savings with Blue 365. Joining is easy. You can visit the Blue 365 website to get started, or by going to www.bcbsnc.com/Blue365. And with your health plan, you can also chat with a doctor on your smartphone, PC, or tablet. Your health plan includes telehealth services from Teladoc. With telehealth, you visit a doctor without going to a doctor's office. It's a great option if you have a minor health problem or behavioral health problem and can't see your regular doctor. It's often more convenient and often costs less than going to the urgent care center. With telehealth by Teladoc, you can talk with a board-certified doctor by secure online video 24 hours a day, 7 days a week. The whole visit takes place through your Teladoc app or your computer. The doctor can even prescribe medicine and send your prescription to your local pharmacy. If you choose the PPO copay plan, you will pay $25 per Teladoc visit. If you choose the HSA plan, you will pay 30% after you met your deductible. You may use your HSA card to pay for telehealth visits. Teladoc can handle many non-emergency health problems like the ones you see in the chart. No matter if you're at home, at work, or traveling, you can use Teladoc just about anywhere, anytime, day or night. Sometimes life can be too much to handle. Situations like stress at work, changes at home, or the loss of a loved one can make you feel like you have nowhere to turn, but you do. With Teladoc, you also have access to a licensed mental health professional who can help you deal with stress, depression, anxiety, and more. Plus, you have the option to choose a telephone or video consult based on your comfort level. You can call Teladoc to make an appointment for a behavioral health consultation. There are 3 ways to get started with telehealth with Teladoc. You can download the app on your smartphone or tablet. You can go to www.teladoc.com, or you can call 1-800-TELEDOC. Go ahead and activate your account after January 1st, so when you need telehealth, you'll be ready. We're glad you have coverage with Blue Cross and Blue Shield of North Carolina. Remember, we're here to help you get the most out of your health insurance plans. If you have questions, please don't hesitate to call us or visit blueconnectnc.com. Also, for your open enrollment, there is a hotline that's available to you for questions as well. You can call them at 1-877-224-3305. Thank you for your time. And Ms. Wanda, I will stop sharing now.
All right. So do we have any questions for Jasmine?
Looks like we have 2, and Maria has answered several in the chat. One of the questions is, what is the copay for specialist?
Jasmine, do you have that?
One moment, I can see if I can locate that. Is that for the PPO plan, Madison?
They didn't specify.
Okay.
I have the information in front of me. For specialists, it's $40 with the PPO plan.
Thank
And
you.
with the high deductible HSA plan, it's subject to the deductible. So it applies to the coinsurance, the 30% coinsurance. Is that what you have, Jasmine?
Yes, ma'am, that is exactly
Okay.
what I have.
Our next question for Jasmine, is LASIK eye surgery covered under our insurance?
If the claim is submitted, I'm sorry, you can go ahead, Ms. Wanda.
No, go. I'm sorry. I believe IMED may go over that, but go ahead, Jasmine.
Yes, ma'am, I was gonna say that may be a question for IMED, because if it's not submitted with a medical diagnosis, it will not be covered.
All right. So Madison, how do we look as far as the slide? Or are we looking pretty good? Do you see my slide? Full screen?
I do not. I only see you.
Okay, here we go again. All right, give me 1 second to share my screen. Share. All right. How about now?
I only see the PowerPoint view. It looks like something was loading, but I don't see the presentation.
You don't see the Blue Cross symbol? Oh,
I see your notes.
you see my notes?
I do. It's good now.
Okay, and now I don't see my notes. Okay. Hold on. How about now? We're good?
We're good.
All right, perfect. So now let's talk about the county's dental plans. Our dental plan is administered by Cigna, and the county still offers two types of plans to choose from: a standard plan and an enhanced plan. Under the standard plan, you have a calendar year maximum of $1,000 per individual coverage. There is a $75 coverage, or excuse me, $75 deductible for individual coverage and $225 deductible for family coverage. Orthodontic coverage is not available with the standard plan. Under the enhanced plan, you have a maximum calendar year coverage of $1,500 for individual, a deductible of $50 for individual, and $150 deductible for family coverage. Orthodontics is available with a lifetime maximum of $1,500 per individual. And just a note, orthodontic coverage is available for dependent children under the age of 19. At this time, I'm going to turn it over to Beth Barnes from Cigna to provide additional details regarding our dental plans with the county. After she's finished presenting, please feel free to ask Beth any questions pertaining to the dental plan. Hi, Beth.
Hey, Wanda.
All right, I'm going to stop and turn it over to you.
Perfect. Thank you. Screen. All right. Give me a thumbs up if you can see my screen. Perfect. All right. So good afternoon, everyone. I'm going to spend a few minutes going over how to locate an in-network dentist and some other programs and services available to you through Mecklenburg County. With Mecklenburg County's dental plans, you can choose to see a dentist that is in Cigna's network or not. You have the option of freedom. If you choose to see a dentist that's in our network, you can save money for your dental services, just like your medical plan. To locate a dentist in Cigna's network, you can search for dentists multiple ways. Number one, if you do not have dental coverage through the county yet, you can search online at Cigna.com to find a Cigna dentist. We do have a nationwide network of dentists. So if you're using Cigna.com, when you look for a network, you're going to choose the total Cigna Dental PPO network. Number two, if you do have Cigna dental coverage today, you can access our member portal at My Cigna to find a dentist. Good news is that 90% of the county's population is already using our member portal, My Cigna. So I'm hoping that majority of you that's attending the webinar today is very familiar in using our portal. And if you still need help finding a dentist, you can always give us a call at 1-800-CIGNA24. We are available 24/7, 365, regardless of holidays. Estimating dental care cost. So My Cigna also offers convenient tools to help you estimate, plan, and budget your dental care cost. You'll find cost estimates for dental treatments and procedures based on your plan information and dentist contracted fees. And you will be able to compare what it costs when you visit an in-network dentist versus an out-of-network dentist. The Cigna Dental Oral Health Integration Program. This is a program that reimburses out-of-pocket costs for specific dental services used to treat or prevent gum disease and tooth decay. This program is for people with certain medical conditions such as heart disease, maternity, stroke, chronic kidney disease, organ transplants, lupus, and rheumatoid arthritis, just to name a few. Again, this program is for people with certain medical conditions with a higher risk of oral health issues. There is no additional cost for the program, and if you qualify, you get reimbursed for out-of-pocket costs for certain dental procedures. So if you're interested in this program, give us a call at 1-800-CIGNA24 and we can get you started. Cigna Dental Virtual Care. While we recommend that you contact your dentist first to see if they can provide virtual care, we recognize that this may not always be possible. Teledentist connects you with a licensed dentist who, through a video call, can help address urgent dental situations like toothaches, infection, swelling, bleeding, and more. They can also prescribe medication to be filled at your local pharmacy if necessary. And virtual care consults are processed as in-network claims and have no copay or coinsurance, but does apply to the county's plan annual maximum, depending on the plan that you're enrolled in. And finally, Cigna's Healthy Rewards program. So through Cigna's Healthy Rewards, Cigna Dental members have access to a full range of health and wellness programs and services often not covered by traditional plans. The programs actually include weight and nutrition management, fitness, tobacco cessation, vision and hearing care, vitamins, health and wellness products, anti-cavity products, financial planning, and healthy lifestyle products. To access Healthy Rewards, simply visit mycigna.com to get started. All right, I am going to stop sharing and see if there are any dental questions in the chat.
We do have two. The first question is, will Cigna be sending out cards this year?
No, dental cards are not required to have access to your dental benefits. Couple of things, if you go to the dentist, you can let your dentist know that you have Cigna Dental. They know exactly where to reach out to us and how to reach out to us. If you really need a card, you can access our member portal, mycigna.com, or the MyCigna mobile app, and you can provide a copy of your dental card to the dentist, the front and back copy of the card to the dentist if they ask for it.
And our next question, if your child needs braces, will the enhanced plan cover the cost?
The enhanced plan will cover the cost up to $1,500. So that typically doesn't cover the cost of braces. Braces orthodontic work is covered for dependent children up to the age of 19. So if your child is over the age of 19, unfortunately, they would not have access to any benefits. If they are under the age of 19, they would have access to the benefits up to a lifetime maximum of $1,500. So once you exhaust that lifetime maximum of $1,500, if you're enrolled in the HSA or if you have FSA dollars, you can use those dollars to pay for those dental services.
And the last question that just came in, if you don't have anyone under 19 years old, you don't need the enhanced plan?
That's your choice. You know, the county is giving you guys 2 dental plans to choose from, a standard and an enhanced plan. Really, if you think about the biggest difference on the standard versus the enhanced gives you a little bit a greater a calendar year maximum, and your deductible is lower on the enhanced plan versus the standard plan. But what's covered under preventive, basic, and major services, they're the same. It's just truly how is it paid is different. So it's really your choice. That's why the county is giving you options to choose which benefits are best for you.
And that's the last question.
Great, thank you.
Thank you, Beth. Thank you, Madison. All right. So as I mentioned earlier, we are switching vision carriers effective January 1 of 2022. Our new partner is and will be IMED. The county will continue to offer two plans for consideration, a standard and an enhanced. Both plans have a zero copay to an in-network provider and a $180 frame allowance. Although both plans are similar, there are some differences. So at this time, I'm going to turn it over to Brian Booth from IMED. Brian will share additional information regarding the county's vision plans. After he's done presenting, you'll have an opportunity to ask him questions. Hi, Brian.
Hello there. You can stop sharing. Okay. All right. Can you see my screen?
Yes.
All right, a success. Well, good afternoon, everyone. I want to spend a few minutes just reviewing the IMED Vision Care benefits that are available to the county. First of all, as you ask yourself, should you enroll in vision benefits, it really comes down to taking into consideration that whether or not you need glasses or if you can see just fine, vision benefits are certainly still a wise choice. And we're going to talk about some of those advantages that you're going to see with the vision plan. Thought I'd start off though with a quick video just to kind of give you some food for thought on whether or not you need to sign up for a vision plan.
Should you enroll in vision benefits? Grandma might say, if it ain't broke, don't fix it. We love Grandma, but even age-old wisdom like this.
Madison?
It
Brian?
froze. Yeah.
Oh, I think it might be something going on our end, because as Beth was presenting, she froze for a quick second or two.
Right. Looks like he's still on. Let's see.
So everyone just give us a minute or two. We need to connect back with Brian. Can we ping Brian and let him know that we lost him? He might need to.
Looks
Time
like
to
he may
connect.
have went out. He's probably trying to get back in.
Yeah. We apologize for the technical difficulties, but technology is great until it's what? Until it doesn't work, until it's not.
If he doesn't come back in within the next minute or so, we may have to come back to him.
Yeah. All right, so Madison, why don't we do this? I am going to share my screen.
And I'm admitting Brian back in, so he may be here. Let's see, Brian. What we can do, we can just move on. I'll try to connect with him and then we can come right back.
Madison, can you hear me again?
Oh,
I can hear you. You're back.
It was very bizarre. I had a power surge in my house when my lights went off. Everything just got disconnected. So I certainly
no.
apologize. Do you have
No
time for me to
problem.
jump back in?
Sure, we're
sure
ready.
do.
Okay, so let me pull up my presentation again. That was very weird.
That's all right.
Okay, we'll try to do this. Are we back in business?
Yes.
We are.
Okay. Again, I apologize. That was very bizarre. Okay, so we'll skip the video. What was left of it, it was telling all these good reasons why you should sign up for Vision, but I'm going to cover those in these next few slides. There's two main aspects. One of them focuses on the value of the Vision plan, which is really discounts, and you can save an average of 71% off the retail costs of eyeglasses as well as eye exams. And there's additional discounts that are going to come into play as well, but I'll talk about those separately. There's also this focus on wellness. So helping you spot not only serious eye conditions, but also serious healthcare conditions, which can be uncovered through a comprehensive eye exam. Things like diabetes or high cholesterol, hypertension, that if you didn't know you had those, can be detected through an eye exam. So those are all helpful things that can be accomplished. The two different plan designs that are available by the county include, first of all, the standard plan. It offers a comprehensive eye exam every single 12 months with a $0 copay. So there's nothing you have to pay in order to get that, that eye exam. There's a $180 frame allowance that are available every 24 months. And then you have lenses and lens options that are available every 12 months with a $20 copay. And then for contact lens wearers, there's a $150 contact lens allowance, as well as coverage for fit and follow-up coverages on your eye exam. So the issue here is that you'll notice the $20 copay. There's also fixed pricing copays on various different types of lenses or lens options that come into play. When you look at the enhanced plan, it's going to look very similar. The only thing that changed is this section in the middle towards the bottom where it talks about a $0 lens copay. So the standard plan had a $20 copay. This one has a $0 lens copay, but there's also fully covered lenses and lens options available with the enhanced plan. So under the standard plan, you'll have fixed copays, but they could, they'll vary depending on the type of lens or lens option. But with the enhanced plan, there's numerous fully covered lenses or lens options, meaning there's $0 copay. More expensive things like progressive lenses or anti-reflective coatings. So that's something you're going to want to pay attention to when you're deciding which program to sign up for. There's a few more benefit basics as well. The frequency of services, I mentioned either 12 or 24 months for the various services on the prior slide. Those are available, or excuse me, are based on a calendar year or plan year basis. So that means that you do not have to wait a full 12 months from your last date of service to use your vision benefits again. Theoretically, if you use the benefits in December of one year, you could use them again in January of the next year. You do not have to wait the full 12 months. Now, one other thing I wanted to point out, since you're moving from UHC to IMED, everybody's benefits are going to reset on January 1st. So even if you are one of those individuals that used your frame allowance in the 2021 calendar year, come 2022, you'll have access to that frame allowance all over again. I also mentioned that contacts are in lieu of lenses only. So that means you're entitled to either a full pair of glasses, which includes the frame and the lenses that go in that frame, or you can use your benefit for contacts and frames. In that case, you would have to pay for the lenses that go inside your frames, which you get a 20% discount on those. So you have some flexibility there. I just do want to remind you though, that either way, the frame frequency is still every other plan year, or that every other, or excuse me, 12 months. So just kind of keep that in mind. In terms of accessing your benefit, you get to utilize our very vast IMED network of providers. If you choose to go outside of our list of in-network providers, we do still have out-of-network benefits. When you're looking at our providers, you'll see we have a large number of independent providers, as well as national and regional retail chains. So we've got over 187 different locations in the greater Charlotte area alone. Some of the national retailers you'll see include Lens Crafters, Pearl Vision, Target Optical, Walmart, and Sam's Club. So all of those brands that I'm sure you're familiar with. We also have some retail brands on the regional retail brands, including the My Eye Doctor stores, America Best, and Clarkson Eye Care. If you are one of those individuals that loves to shop online and you want to do that for your glasses as well, or certainly your contacts, you have availability to do that through 5 different options: lenscrafters.com, targetoptical.com, rayban.com, glasses.com, and contactsdirect.com. So lots of available options for you. When it comes to trying to find a doctor, an eye doctor, you can utilize our provider locator at imed.com. You'll want to make sure you choose the Insight network. There's going to be several choices for you to look at in terms of network. You want to make sure you choose the Insight one. That is our most popular network that you're going to see out there. You also have the ability to look up providers on a mobile app, on your member app, as well as your mobile app. We'll talk about that in a second. And then we'll be sending you a listing in the mail too with our welcome kit. So you'll be able to have an opportunity to look at providers that way too. I mentioned earlier some of the savings that are available. These are the most common ones that you're going to see above and beyond the allowances and copays that are part of your vision plan. But if you've exhausted your benefit already for the year, and you want to buy another pair of glasses, or perhaps your child has lost their glasses at school, which I'm sure has happened more than once, you can get access to a 40% off an additional pair of glasses. You can use that as often as you need to. There's also a discount off of LASIK. I saw that question earlier in the meeting. So there's a 15% discount off of LASIK surgery, or 5% off the promotional price. We do have a network of providers through the U.S. Laser Network for LASIK surgery. So again, that's available in the plan design summary as well. There's discounts off of the remaining frame balance. So if you spend more than $180 on your frames, you get a 20% discount there. There's also discounts off contact lenses, pretty much any other vision-related service that's not covered under the plan. You get a 20% discount, including non-prescription sunglasses. And then we have discounts off of hearing exams and set pricing on hearing aids as well. So finally, just a reminder, you have some tools available to you to help you utilize your vision plan throughout the year. I mentioned earlier a welcome kit. Everyone that signs up for Vision Care will receive a welcome kit sent to their home. It's an envelope that's going to include 2 ID cards, a summary of your vision plan, a listing of your closest eye doctors, which will be split between independent providers and retail providers. Those are based on your resident zip code, as well as access to some other tools, wellness tools, and some of the features here in terms of materials that are available on your member app or your member web. It's a great member app on your phone that you can save your prescription. You can set reminders on when it's time to get an eye exam, or even to change your contact lenses. And on the member web, one of the cool tools is, in addition to getting looking at your EOB or downloading ID cards, if you need extras of those, is the ability to actually view your out-of-pocket costs before your visit to the eye doctor. So it's a cost transparency tool that's available to you as well. So with that, again, I apologize for the delay, but are there any questions specific to Vision Care?
Looks like we have a few. The first question is there a additional fitting fee for toric lenses?
There's additional fit and follow-up fee for any type of contact lenses, and it will vary depending on whether you have conventional or premium. So those would be the premium ones. So yes, there will be, it'll vary by doctor, but as long as you go to an in-network doctor, there is either a copay or a set discount depending on the type of contact lenses you're going to get. Let me just look at that first of all, because I think I may have had, yeah, actually it's a $20 copay that's involved for the fit and follow, regardless of what kind of contacts you're getting.
All right, our next question is regarding to the online options that IMED has. Were the ones within the presentation the only options?
Yes, those 5 online options are the only online retail options we have available. So some of the questions in the past and other meetings have been Warby Parker always seems to come up, but Warby Parker is not a covered provider, in-network provider.
And our last question, how are out-of-network reimbursements handled?
Those are, you simply pay at the provider that you choose to go to. You'll get a receipt, and then you have the ability to take a photo of that receipt and file your claim through your mobile app or through your member web.
And that's the last question.
Okay, thank you.
Hi, Madison. So thank you, Brian. Madison, do you see, how do we look as far as the slide?
It looks good.
Okay, wonderful. All right. So most of you are probably familiar with Marathon Health, but there are some of you that may not. Marathon Health is an independent provider of primary care clinics. They have several near-site locations and offer services such as primary care, biometric screening, chronic condition treatment, lab work, personal health coaching, just to name a few. To speak on Marathon Health, I'm now going to turn it over to Caitlin Cross. Please feel free to ask Caitlin questions after her presentation. And if she can't answer it between the both of us, we will certainly get back to you. So Caitlin, are you ready?
Absolutely, Wanda. Thank you so much.
You're welcome.
Good afternoon, everyone. My name is Caitlin, and I'm a client advocate with Marathon Health. And I thank you so much for having me here today. I'm very excited to be here. Here in just a moment, I will play a recorded video that we created. The voice in the video is Jenna, who is also a client advocate with Marathon Health. And as Wanda said, if you have any questions during the video, please feel free to place them in the chat. And if I don't have the answers to them, I will definitely document all of the questions and make sure I get the correct answers to Wanda right away. So without further ado, I'm going to go ahead and share my screen. Are you able to see my presentation? Okay.
Yes.
Awesome, thank you. I'll go ahead and share the sound and I will hit play.
My name is Jenna Ewing, and I am the client advocate with Marathon Health in the Charlotte network. The purpose of this presentation is to give you a better understanding of who Marathon Health is and how we can help serve you and your family. Marathon Health is a primary care physician's office with 6 health center locations in the Charlotte metro area. Our 6 health centers range in hours from 7 a.m. till 7 p.m. All of our centers are by appointment only to reduce wait times. We see members on the benefits plan in your family ages 3 and up, so that includes your spouse or dependents. The 6 health centers are located around the 485 loop in Charlotte. Our newest health center location we opened in Matthews, North Carolina in March of 2020. As mentioned before, all of our health centers operate Monday through Friday, with the exception of our North Lake location, open on Saturdays from 8 a.m. till 12 p.m. You have access to all 6 of these health centers. So should you want to get labs done at one of our health center locations, but see a provider at another, you may go to any of the 6 health centers included in this network. The design of this model was so you could have access to care close to home and work. This here is a service overview. The purpose of this slide is to give you a better understanding of what Marathon Health can do for you and your family. We operate as a primary care physician's office, and what that means is we can do your annual routine physicals if you are 16 and up. We can treat you for acute and preventive needs, so if you get sick or if you would like your chronic disease managed with us, that includes high blood pressure, diabetes, thyroid issues. We also have a dedicated referral team that can help connect you with somebody in network if it's something that we can't handle at the health center level, such as a sleep study or dermatological referral. We do see children aged 3 and up on the medical plan. We see children for acute needs, such as cuts, bumps, bruises, sprains, or if they're sick and have an ear infection. The one caveat to that is we see children for camp and sports physicals. Our wellness services that are included with your Marathon Health access is health coaching and behavioral health needs. All behavioral health services as well as health coaching services are free at no cost to you. This can be one-on-one health coaching or group wellness programming. We have an on-site laboratory at each of our 6 health center locations. Labs are free at no cost to the patient. We also have an on-site dispensary and a home med pharmacy. The on-site dispensary is used for acute medications when you are sick or need something at the time of the appointment. Our home med delivery service is where we leverage this pharmacy for chronic care medications, such as thyroid medications or blood pressure medications. In 2020, due to the COVID-19 pandemic, Marathon Health transitioned their model of care to not only being telephonic and in-person, but launched virtual care. As a patient of Marathon Health, you now have access to our providers virtually, telephonically, or in person. The 5th mark on this slide is Marathon Health Portal. The portal is where you can communicate with our ambassadors, our clinical team members. You can schedule appointments as well as access test and lab results. The way that our model is set up is by appointment only, and those appointments are either 40 minutes, 30 minutes, or 20-minute appointment types. The 40-minute appointments are typically for new patients to establish care. This also is included in our annual physicals. A 30-minute appointment is going to be if you are a sick patient and it's a little bit more complex, or if you're new and not feeling well. The 20-minute appointment is for routine care for established patients. So for those that are established with us, we know your medical history, your current medication regimen, and you're just not feeling good, or if it's just a check-in on your chronic care management where a quick set of labs are needed and just to touch base with one of our providers on how you're doing. As I mentioned before, we do have medications on site as well as a home med delivery system. We encourage patients that do not have a primary care or a provider that they see in the network to leverage Marathon Health as their primary care of choice. We can not only manage the current medications that you're on, but do routine lab work and your annual physical for preventive reasons at no cost to you, regardless of the plan that you're on. All preventive services are free. We do have an on-site laboratory at our 6 health center locations. Those labs are at no cost to you and anybody that is on the plan. Sometimes we have patients that have an established primary care in the network, and we encourage that. We're not here to replace your primary care if you have one, but we are here to be one if you need one. We sometimes have patients that use us strictly for our labs only. Let's just say that you have a specialty doctor such as a cardiologist, and you have to get labs every 3 to 6 months. You can have that specialty doctor fax Marathon Health that lab order, and we can draw those labs for you on that specific cadence. We would then send the results of those labs back to your specialty doctor, and there would be no fee for you as the patient. As I mentioned before, we do have a dedicated referral team to the Marathon Health Charlotte network. What this means is if you were to come see one of our providers and you were having issues with sleep, or you had a mammogram up or colonoscopy that was due, or let's just say your child fell at school and you're uncertain if they need an x-ray or not, you can schedule an appointment with one of our Marathon Health providers that can assess the current situation and the need for the referral, and they would connect you with our referral team. Our referral team will take your medical insurance, put it through our system, and reach out to you within a 24 to 48 hour timeline, depending on the need. They would then schedule that appointment for you and follow up with the results to take the heavy lifting off the patient. Health coaching and behavioral health services are a part of the Marathon Health benefit. We have 3 dedicated health coaches in the Charlotte network that consist of a certified diabetic educator that is a registered dietitian, an exercise physiologist, and a CHES certified health coach that is passionate about spiritual and behavioral health. We also have a team of 4 behavioral health clinicians, varying from licensed professional counselors to licensed clinical social workers. All health coaching and behavioral health appointments are free at no cost to the member. So how do I schedule an appointment with Marathon Health? You can call our centralized scheduling team, our member relations team, Monday through Friday, 7 a.m. till 5 p.m. or Saturday mornings. They can help set up an appointment for you. You can scan the QR code below. You also can register online at member.ourhealth.org and create a profile where you can go into the member portal and self-schedule an appointment that way. We appreciate your time in listening to our presentation. If at any point you have any questions about Marathon Health and what we can do for you and your family, feel free to reach out to our member relations team or go to marathonhealth.com and visit us. Check us out. Thank you for your time and have a great day.
Thank you, Caitlin. Are there any questions for Caitlin?
Let's see. I see 2 questions. One was, is it possible if we can see the page with locations and times again?
Oh, yes.
Okay.
Oh, sorry. I didn't mean to interrupt. I'm sorry.
No, you're fine.
I will go ahead. I'm going to pull that page up right now. And then is it okay if I reshare my screen?
Yes, go ahead.
Okay, I will. Thank you. All right, I'm going to reshare. Okay. Is that showing for you the screen with the locations and hours?
It is.
Okay, awesome.
All right, and they said thank you. The next question is, if I'm feeling sick and can't get an appointment with my primary provider, is that a situation when I can use Marathon Health?
Yes, absolutely. Absolutely. We do have same day appointments available as well. So that's something I learned. I knew about it, but something I wanted to emphasize from in the previous meeting we had earlier today. A question was asked about opening up our availability or increasing our hours during like cold and flu season. And so we do increase our same day appointment availabilities during cold and flu season. So any day throughout the year that we are open, we always will have like a block that'll be open for same day appointments. And then during cold and flu season, we do have a larger block of appointments for same day appointments. If you are sick and you don't need to be established with us, you can have another primary care provider and see us when you're sick. That's absolutely a service we have and you can definitely take advantage of.
All right, let's see. The next question, we may have to take this offline, but it's in regards to Marathon Health's behavioral health. This employee mentioned that they were charged $200 to see a psychologist. And they were mentioning that they think it should be better education on what services are actually free and the difference between EAP and behavioral health assistance. So it's kind of a comment, but thought I'd share.
I appreciate the comment. We will take note of the additional or increased education and wellness around employee assistance program and Marathon Health. So yeah, we will definitely take note of that. We'll have to take the fee offline and look into that separately. Okay.
Sounds good. And I know the person logged on under a different account. So if you can send me a direct message, that will be great with your name and email. Also, one final question. Will I be able to get a primary doctor with Marathon Health?
Yes, absolutely. We do have providers at all 6 of our health centers. And when you log on to your portal, your Marathon Health portal, on the right-hand side of your screen, you should see an option to view more information about our providers. So if you want to take a look and kind of read about some of the bios of our providers and just kind of one way to get to know our providers, but definitely you can absolutely establish a primary care doctor with one of our providers here within Marathon Health. Great question.
And let's see, we have one final question. Is there an advantage of using Marathon Health over urgent care for same-day appointments?
Yes, absolutely. So for Marathon Health, there is a chart. There would be a small fee to see us for an acute, so like a sick visit, whereas the price if you were to go to an urgent care for a sick visit would be much higher than the price that would be to come to Marathon Health for a same-day sick appointment. And if you did need a referral out to for more or higher, like if you needed an x-ray or needed something like that, we could provide that referral service for you. So definitely, I would say price would be one of the advantages as well as convenience. But Wanda, did you want to speak to any of that?
I'll just add that there's also an advantage to going to Marathon Health because Marathon Health is a member-only organization. So you're not competing with the public and trying to make an appointment or services. So Mecklenburg County, the city of Charlotte, and I believe Belt are members of Marathon Health. So I think that's a plus, knowing that you can go online, make an appointment, and potentially be seen without having to compete with outside walk-ins as well, or the citizens of Mecklenburg County.
And I absolutely thank you so much, Wanda. And I definitely want to encourage you to, if you aren't feeling well and maybe you're not seeing a same-day appointment available, please feel free to give us a call. There is a phone number that's going to be on your Marathon Health portal and then also on the main homepage of the portal. Please give us a call because we want to do absolutely everything we can to help get you seen by one of our providers.
Thank you, Caitlin, and thank you, Madison. Madison, how are we looking on the slides here?
So far, so good. So it looks like it's on the Marathon slide.
Okay, well, it should be. Hold on.
Hey, Wanda, would you mind if I answered one last question? I just saw pop up.
Sure, go ahead.
Thank you. Sorry, it's much easier for me to talk through it than to just type it up real quick. But I did see a question on COVID shots and testing. And currently we don't have COVID vaccines, but we are in the process of getting them. And so hopefully very soon we will have an update on that. But as of right now, we don't have the COVID vaccine. But again, we are working to get it. And then as far as COVID testing, we are just testing symptomatic patients only. So not like a travel test or anything like that, but if you were showing symptoms of COVID, please give us a call and we can help with symptomatic testing. Thank you. Sorry to interject.
No problem. Thanks, Caitlin.
Thank you.
So Madison, are you seeing voluntary benefits on your end?
I am.
Very good. So now let's talk about the county's supplemental benefits, or some might refer to it as voluntary benefits. Mecklenburg County offers employees cancer, accident, medical bridge, and critical illness, which are offered through Colonial, and they are pre-tax with the exception of critical illness. Critical illness is a post-tax benefit. The county also offers pet insurance through Nationwide. All of the voluntary benefits are administered by our third-party broker that we've partnered with called PeerScrew. All of the benefits are 100% employee contributed and are portable. Unlike the core benefits, coverage will remain the same unless you choose to make a change. And on the slide, there's the website for PeerScrew and Nationwide. Remember, open enrollment is from November the 8th through the 19th. If you do not enroll or waive coverage in the medical, dental, vision, and flex spending accounts during the designated online open enrollment period, you will not have insurance for the 2022 plan year. To complete your benefit elections, all you have to do is log into MyHR, go to Employee Self-Service, click on the benefits tile, and click on benefits enrollment. To enroll in the voluntary benefits, critical illness, cancer, accident, medical bridge, you'll need to visit the Peers Group website. Pet insurance, you would have to go to Nationwide website. Another good thing to remember is that this is a good time, actually a great time, to enroll or update your 401k, 457, or the North Carolina 529 college savings plan. It's just a good opportunity to, since you're thinking about benefits, take a look at the supplemental deferred comp benefits or savings plans, as it's known. Great time to make changes and to even enroll. It's also a great time to review your beneficiaries. So take a look at the beneficiaries for those plans that have one, like your life insurance, 401k, etc. Okay. Everything that you've heard so far is good information, but there's one that I'm excited about. This year is the first time the county has ever offered an open enrollment raffle. So we are excited to announce that through November the 8th through the 19th, we're going to have a raffle and you have an opportunity to win some really, really great prizes. So in that blue dot, you'll have a list. So there's a list of the prizes that you could potentially win. Google Home, Bluetooth speaker, a Yeti cooler, air fryer, wireless earbuds, and the grand prize. Take note, the grand prize is a 50-inch smart TV. Some really great stuff. The drawings will be held on Wednesdays and Fridays during the 2-week window of open enrollment. The first drawing will be held on November the 10th, and we will announce 20 names. Only those that complete their enrollment by midnight the day before each drawing will have an opportunity to win. So don't miss out, enroll early, and increase your chances of winning one of these great prizes. This slide is a list of resources, phone numbers, website that you can use as you consider your elections for 2022. So a lot of information has been shared today, and we don't expect you to remember them all. And we're sure that you're going to have some questions later after you get back, log off or get back home or whatever. You're going to have some questions. So these are some resources. The same resources that you see here are also located in your open enrollment guide. You should have received your guide by now. I've received mine. I think I got mine last week, and many of my colleagues received theirs last week as well. So by any chance you did not receive your guide, the same information is available on MEC Web. And before I leave you, there's another tool, a tool that the county has had in place, first put in place last year, and it had such great feedback and positive response. We decided to bring it back again this year, and that is the Benefits Virtual Fair. That is a online platform, web-based platform that you could tap into that has information about the county's benefit plans. That is offered 24/7, 7 days a week, and you can access it through the comfort of your own home or wherever you are with your family or significant other, so that you can make the best and informed decision for you and your family. But the key thing to remember, the main thing to remember is you must enroll. So please Do not forget to enroll. There's a 2-week window. We'd love for you to enroll early, increase your chance of winning one of those nice prizes, and some great stuff. But before I close out the presentation, we have a special guest. We have Erin with Work Green, who is going to share some information about the Work Green program. Erin?
Yes, ma'am. Hi, Miss Wanda.
Hi, I'm going to stop sharing. If I can get my mouse to cooperate. Here we go. Here we go. I have stopped.
All right, perfect. Thank you. So quick show of emoji hands. How many people have heard of or participated in Work Green in the past? Let's see if I can. Cool. So for those of you that don't know, my name is Erin. I'm the Sustainability and Resiliency Manager for Mecklenburg County, and I'm here to talk to you about Work Green. Work Green is our environmentally focused employee engagement and award program. In 2004, the county passed our first environmental leadership policy, and then an updated environmental leadership policy and associated action plan was passed in March of this year. This policy commits the county to operate in a manner that provides employees with opportunities and incentives to practice environmentally sound behaviors. And so to register and participate in Work Green, you have to visit the Work Green information page, which is accessed via MacWeb. I'll show you where that information is momentarily, but do keep your eyes peeled for this logo. This is kind of our go-to logo for Work Green throughout the MacWeb world. And so Work Green not only works to educate our employees about the benefits of our local community and our local environment. You can also earn time off awards while on the job or outside of work. And how do you do that, you ask? Well, if my mouse would work, credits can be earned by participating in webinars and courses that are focused on the environment and are housed within Mech Talent. You can participate in in-person activities, such as stream cleanups, and then taking part in environmentally friendly activities in your office, such as a green team. 10 earned credits over the course of a fiscal year equate 4 hours of PTO, and 20 hours of earned credits over the course of a fiscal year equate 8 hours of PTO. I do want to stress that we are working to get more virtual opportunities for folks to interact with, because while I recognize that we are coming back into the office, we are still in a pandemic. Not everybody is necessarily comfortable with cleaning up a stream with a whole bunch of strangers. And so we're working to get enough virtual opportunities so people can actually earn this time off award 100% virtually. Not only can you go through these methodologies to get your credits, but you can also earn credits through commuting to work by alternative transportation, bike, bus, light rail, carpooling, vanpooling, walking, volunteering with local environmentally focused groups, and then watching and reflecting on environmentally focused documentaries online. For those groups, we do have a list of opportunities on our Work Green page, so I'm going to show you all, but that's not an exhaustive list. There are many organizations within our local area that do various environmentally friendly activities, and if those are folks you want to volunteer with, perfectly fine. Just be sure that you denote that within the Work Green form. And then in terms of watching environmentally focused documentaries, we do ask that you reflect on what you learned from those documentaries and let us know how that information applies to either your work life or your at-home life. So I'm going to stop share and then I'm going to reshare our website. Too many screens. So we're all familiar with SharePoint, I hope. And if you're not, this is great, SharePoint. If you scroll down to under support apps, you'll find that Work Green logo I was talking about. The color has changed, so I need to update that on my slides. If you head to the Work Green site, you'll see that we have our program overview, find activities, and log and track credits. So I'm going to go to find activities. And so this is where you'll find those in-person opportunities I was talking about. They're listed up top. You click on any of these, this will give you more information about what's happening, where it is, how to register, those kinds of things. There's some self-guided opportunities listed in the middle of the page, and then towards the end, we have those open source, those documentaries I was speaking to. We have open source documentaries, which are all on YouTube, and then paid service, which is Netflix, Hulu, HBO, what have you. And so again, you can watch those documentaries and then reflect on them within the Work Green form, which I'm going to show you how to fill out right now to get those credits. We're going to go back to the Work Green main page. And I want to show you all how to actually log your credits. And you're going to click on log and track credits, and then click on log your credits again. And so you're going to fill out this form to log your credits. Please use your correct county email. This is the only way we can track how many points you've achieved. So if we have the wrong email for you, then we can't give you those credits, which means you won't get that paid time off award. You select whatever department you're housed within, and then you can choose this pre-populated list as to what opportunity you participated in. Outside of the form, we also have, or outside of the things that are on our website, we also have opportunities listed in MEC Talent. If you search for trainings in MEC Talent, you can filter by, oh good. So maybe I won't show you that, but I'm gonna try one more time. Ideally, you can look at various courses, perfect, that these are all the courses that we're offering currently within MEC Talent. You can filter them by subject, and if you scroll all the way down to Work Green, you'll find those modules that are available online. So you can take these virtually and log your credits with them. So you'll use the same form I just showed you after you complete that particular course. And of course, it'll show up on your transcript. And I'm gonna stop talking. Any questions for me?
We do have one, which is
Oh,
a
good.
common question. Do library staff have a way of accessing Work Green?
Yes, great question, Madison. We have received this question a few times now in these sessions. So I'm relatively new to the county. I've been here since January, and I naively thought that everyone in the county could access our intranet. Turns out that's not the case. So because libraries do not have access to MEC Web, we don't have a workaround for that right now. So at this exact juncture, no. However, I am working with library leadership and folks in the county manager's office to figure out a way around that. I don't know if that's a new program or if that's figuring out how our library folks can access this information. So not right now, but hopefully soon is the short answer.
And that's the only question I have.
Cool. Thank you.
You're welcome.
Thank you, Erin. So that concludes our open enrollment presentation for today. We will entertain as many questions as we can. With a large group like this, I'm pretty sure we're not going to get to everybody's question online, but we will commit to answering those questions, and we may have to email them to you. So Madison, do we have any questions in the chat?
Seems like we did. Let's see, I'm having to scroll back through. Let's see. One question was in regards to visiting the ER. Let's see. This person asks, can we go to either Atrium or Novant for ER services, or is it only one?
You can go to either.
And also for the high deductible health plan, where can we go to the emergency room or urgent care services? Is that under Blue Cross and Blue Shield?
So repeat that question again.
This person asks, this person asks, for the high deductible plan, where can we go for emergency room or urgent care services?
You can go to any hospital that offers emergency room care and urgent care. It's not restrictive. If it's an emergency, I truly hope it's an emergency. When I say I hope it's an emergency, is it one of those situations where it is truly an emergency, or is it something that could be taken care of at the clinic? Just something to think about. But our coverage, our benefit plan covers both hospitals, and both hospital has emergency services available.
All right, our next question, is there a benefit for adding additional funds to the HSA versus just paying for medical expenses out of pocket when I
Oh.
use the seat money?
Great question. I love whoever asked that question. I think it is. The health savings account is a great vehicle to consider contributing to for your medical expenses, because it's one that, not only are you receiving the employer's contribution, you are able to contribute to that, and it rolls over from year to year to year. And here's something that for some of the newer employees who are not eligible for the retiree medical plan, because they were hired after that program ended, but that plan, that health savings account, is a account that you can use when you retire. I mean, you can keep building on it, and you can tap into it for medical expenses, and you can keep it. It's not tied to the organization. That is a personal account. As long as you work for Mecklenburg County, the county's contribution goes in it. That is your money. Your money goes in it. That is your money. When you leave, that account goes with you. So long story short, I think it's a great opportunity because it's a way of planning for the future, medical expenses for the future.
And that's the last question I see in the chat.
Wonderful, wonderful. Well, I want to thank everyone for the time, your engagement. I hope this has been beneficial and helpful. We love the feedback, so give us the feedback on how we can improve for next year. Again, thank you all for participating. And if you have any questions, you have your resources that I mentioned earlier, and don't ever hesitate to reach out to the Employee Services Center. Thank you all and have a wonderful evening.